here on the program. And Panorama is a participatory interactive program. So, of course, that means you are a part of it, not just by listening, but also by contributing via our social media channels. That's right. We have Twitter, we have Facebook, and we also have WhatsApp for you to join in, listen, and comment. Right. On Facebook, we're streaming live right now. So if you head to Splash 106.7 FM, you get the added advantage of watching us as we engage our guests as well as commenting. On Twitter, we should have Twitter space set up shortly. So if you find us at Splash FM 1067 on Twitter, you can listen from there, and you can also tag us in your contributions. Use the hashtag Panorama on Splash as you tag us. WhatsApp number is 0817-555-1067. And of course, we have other means of listening to Panorama. And as a matter of fact, listening to all of our rich programs. We have a website, www.splashfm1067.com. We also have an app that you can find on your Android or Apple stores, as well as, the radio streaming websites and apps too. You find us there. So if you ever have the occasion of being outside the state and you're worried that you'll be cut off because you can't listen from your regular radio, you can listen via all of these mediums. My name is Lola Meduteni. Good morning.
Good morning to you. Lola has reeled out all of the several channels through which you can listen to Splash 106.7 FM, your spot for choice, really. Whichever works for you, if it is the regular radio set, or you like to listen online, or anytime you're out of the state, we don't have to be out of sight when you're not around. So let's do this together every weekday, from Mondays through Fridays, from 8 a.m. To 10 a.m. is when we get to do this Panorama on Splash 106.7 FM. My name is Gboyega Olaniyi. Welcome to the program.
We'll begin with our issue of the day, which you must know if you are a regular listener of Panorama, from now until about 9, and then we have From the Pages for the latter end of the show, which is a newspaper review segment. For our issue of the day, we often decide to spotlight a particular issue, as the name suggests. And today we'll be talking health insurance, which you would know if you've been following our social media pages. That's one benefit of following us on social media. You get to see our banners, you get to know what we'll be discussing, so you can schedule an appointment, or rather schedule a reminder so you can listen to the issue of the day. Now, today we'll be talking health insurance. So without further ado, let's begin. Access to quality health care is a universal human right. Hence the reason for its place at number 3 in the Sustainable Development Goals. According to the World Health Organization, at least half of the people in the world do not receive the health services they need, with about 100 million people being pushed into extreme poverty each year because of out-of-pocket spending on health. An estimated 11 million Africans fall into poverty due to the cost of healthcare, and in Nigeria, out-of-pocket health expenditures account for more than 70% of overall health spending, when compared to 35% across sub-Saharan Africa. In 2018, Nigeria ranked the third highest country with the highest out-of-pocket health spendings. 76.6% of health spending in the country at the time was out-of-pocket. Furthermore, according to reports, about 8 out of 10 Nigerians do not have a health insurance cover, with the majority of them paying cash if they have to visit a healthcare facility when sick.
Universal health coverage means that all people have access to the health services they need, when and where they need them, without financial hardship. Protecting people from the financial consequences of paying for health services out of their own pockets reduces the risk that people will be pushed into poverty because unexpected illness requires them to use up their life savings, sell assets, or borrow, destroying their future and often those of their children. On the 19th of May, President Muhammadu Buhari signed into law the National Health Insurance Authority Act of 2022, repealing thereby the 2004 National Health Insurance Scheme Act. The repealed NHIS Act had been criticized for covering less than 5% of the country's 220 million people due to lack of implementation and political will.
Back in February, the Ogun State Governor, Prince Dakwa Abiodun, formally launched the Basic Healthcare Provision Fund program and Ogun State Informal Sector Health Insurance Scheme in Abeokuta. For our issue of the day, let's talk health insurance for Ogun State residents as we engage the Executive Secretary, Ogun State Health Insurance Agency, Dr. Afolabi Dosumo. Good morning, Doctor. Thank you for joining us.
Good morning, Lola. Good morning, Gboyega. And good morning to our listeners all over the world.
The Ogun State Health Insurance Agency predates this administration. However, the governor launched this BHCPF program as well as the Ogun State Informal Sector Health Insurance Scheme a couple of months ago. And, I saw some of the announcements online and the things promised. But you tell us, what does it change, as it concerns health insurance for Ogun State residents, especially in light of the newly repealed NHIS Act?
What has changed?
Yes.
Okay. The Ogun State Health Insurance Agency was strengthened and empowered by this administration when they came on board. There were some conditions that had to be met by the state government, which they prevented us from accessing the Basic Healthcare Provision Fund before this administration came in. But immediately Prince Dakwa Abiodun came in, one of those major conditions was the payment of 100 million matching grant. And the administration paid it, and we went and started the journey towards universal health coverage, just as Gboyega said, with the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund is a federal government intervention. The source of funding is 1% of the federal consolidated revenue, and this amount is shared among the 36 states and FCT every year. Of course, some states have been running the Basic Healthcare Provision Fund since 2016, 2018, but we only came on board last year. The launching was the ceremonial aspect of it. We've been doing some groundwork since early last year that had to do with trainings and so on and so forth. What has also changed is the fact that on this Basic Healthcare Provision Fund, it's for the vulnerable people. That is the poorest of the poor. And the states, the program condition is that one PHC per ward must be on the Basic Healthcare Provision Fund. So we have 236 PHCs that are currently running the Basic Healthcare Provision Fund. But for health insurance, just 160 have been able to meet the accreditation process. So we have 160 facilities offering health insurance in the state. We have our secondary facilities, our general hospitals and state hospitals also running health insurance. We have some private facilities also running health insurance. And, well, let me stop there for now and allow you to ask.
So the one you talked about as regards that of the vulnerable, what exactly does it cover for these poor people? What exactly do they have access to?
The Basic Healthcare Provision Fund also prescribes a minimum basic healthcare package. And that is what it's covered. But I can tell you, we have what we call the Ogun State Health Benefit Package. Benefit package means the services that are covered under health insurance. And ours is a very comprehensive one. We started also in 2016 with Araya Den, and we looked at disease conditions that are peculiar to Ogun State. So a lot of disease conditions that the average residents of Ogun State are likely to experience are on the benefit package. Mention it, and I can tell you if it is there or not, but to just mention a few: malaria, typhoid, hypertension, diabetes, most of these other surgeries are also on the scheme. Basic surgeries, myomectomy, anorrhaphy, appendectomy, and so on and so forth. There is a full comprehensive maternal care package there, which means that once the woman gets pregnant, she comes on the health insurance scheme. Till 6 weeks for her after delivery, she's covered under the health insurance scheme, and 12 weeks for the baby. So anything happens during that period from the very first day she knows she's pregnant and she comes to register till that 12 weeks after delivery, it's all covered, including cesarean section.
Well, one of the improvements said to have been made on the newly repealed act is that the former one did not do much for the informal sector, but this new one is promising to do more for the informal sector. Can you say the same with the Ogun State's health insurance scheme and,
But
programs?
let me just correct a little misconception there. The major change in the new act is the fact that it now clearly states that health insurance is mandatory for all Nigerians, for all residents of the country. Unlike the former one that it was voluntary, it was optional. Now it is mandatory. And it is because it is now mandatory that people now feel that it is doing more for the informal sector. Because we all knew that all along, health insurance, it's almost synonymous with workers of federal government or state workers
Right.
in the country. So people in the informal sector who do not want to partake or who do not understand it had no opportunity, or there's no enabling environment or enforcement to bring them on board. But this new act clearly spells that it is mandatory. So it's a matter of time. Everybody needs to come on board the health insurance scheme in one way or the other. If I can just explain a little bit more, there are basically 3 schemes everywhere, both at the federal level or at the state level. We have the formal sector scheme, the informal sector scheme, and the vulnerable scheme. Every state can give it different names or whatever, but basically it's a scheme for the vulnerables. And the vulnerables are pregnant women, children under 5, the aged, the mentally challenged, and so on and so forth. The Basic Healthcare Provision Fund is an example of a vulnerable program. Of course, the state government is also going to roll out very soon the equity scheme, which is also going to be for the vulnerable. Now, what has changed in the states? The state's law, it's almost there was an NHIS template, which each state now adopts and adapts to the peculiarities of the states. So you see that most of the laws in the 36 states and FCT are similar to an extent, and it is what you find in one that you also find in the other. The NHIS law that was repealed was done far back some years ago. The one that we are currently operating was signed into law in 2018. So we are taking care of some of what the new NHIS Act is now bringing on board. So you see that we won't need to do a lot of amendments for us to just be at par with the new act that has been signed.
I see. Are there plans to domesticate it, or do you not think it's necessary?
To domesticate the
The
NHIS
new-
Act.
Yes.
I won't call it domestication. We have our own act.
So
It
just
is more
look at,
of tweaking it and amending it to now fit the realities on ground.
So, let's talk affordability, because when you talk NHIS, like you said, it's become synonymous with civil servants, federal and at the state level, and maybe some organizations too, who have also maybe even made it voluntary, maybe not compulsory too. But how affordable for the vulnerable? Does it mean that the 1%, of the consolidated fund that is being shared, does it make it totally free for, that category and for all of the other faces as well?
Okay.
How affordable is
Very,
health insurance?
very, very affordable. If you had been at the launching on the 3rd of February, for civil servants, for those in the formal sector, which are civil servants, public servants, and the organized private sector, it is assumed, or that is what is going to happen, that a percentage of your basic salary is going to be deducted, and your employer also paid a certain percentage on whatever it is agreed on for the payment of your premium. Now, for the informal sector, let me mention the vulnerable group first. For the basic healthcare provision fund, it's totally free for them. The federal government and the state government are in collaboration, and once you are registered on the basic healthcare provision fund and you get the basic healthcare provision fund health insurance card, you access the benefit package free of charge at no kobo. Now, how do we get the vulnerable groups? We have the social register in the states, as in some other states. We have some other means of targeting the poorest of the poor. And once you are selected and we register and enroll you, and you get the card, it is free. For the informal sector, why do I say it is very, very affordable?
Before you get to the informal sector, this vulnerable group, is it just for the poorest of the poor?
The
other time you
pregnant.
talk about the pregnant.
Now, of course, the poor
also,
pregnant woman, the poor under 5 children.
Not every pregnant woman.
No. The funds presently will not allow us to cover all the poor people in Ogun State. Of course, the statistics is that the poverty rate in Ogun State is about 9-10%. So if you do 9-10% of 7 million, you probably get about 700,000. The funds we're giving, of course, will not cover that now. The new act, one of the other changes in the new act is that it has also prescribed a specific source of funding for the vulnerable groups in the country. In fact, the studies have been done, some calculations have been done, and it has arrived that there are 83 million people living below the poverty line. And all these people must be brought on board the basic healthcare provision fund. And discussions are ongoing.
So what is this funding source?
There's this talk of tax on, you are very correct, that maybe it's 1 kobo on every call. There's talks about maybe a charge on airfare, airlines airfare, or these are soft drinks. But I'm sure, they are working on it. And once a pool has to be created for these 83 million people because they can't pay. And in your opening remarks, you mentioned the fact that in fact, it's more than 76.6% now.
That was
the
at
national
2018.
It's even 2017. It came out in 2018. The 2017 National Health Account says that 76.6% of Nigerians pay out of pocket. It's a big aberration. It's an abnormality. Of course, we all refer to UK and US. It's less than 15%. And of course, just as you also said, it is when people put their money in their pockets to pay, it pushes them into poverty, and we call it catastrophic spending. You see a lot of, we need donations, GoFundMe for renal transplants and so on and so forth. People just can't afford it. There are people out there in the community that to even go into our hospitals and get treated for malaria, it's a big issue, a very big issue. You'll be surprised that at 2,000, 5,000 naira, it's an issue to people, even in the country. And so to go back to what I was saying, now that, there's going to be that source of funding to take care of every one of them. And it is hope that, of course, when that sees the light of day, even the 700,000 poor people in Ogun State, we also get that funding. So every poor pregnant woman, every poor under 5, every poor mentally aged, and so on will be covered. Now for the informal sector. The informal sector, as you know, are people who don't have that structured salary. But there are a lot of funds in the informal sector. There are people in the informal sector that are far, far richer than the three of us.
True that.
The money they make every day, if you can just put them and look at it at the end of the month, it's a lot. But unfortunately, because there is no salary structure for them to see, most of them do not realize how rich they really are. So what has the state government done is that the premium is just, let me not say just, is 12,000 naira per year. And the state government has also given this, it's discounted, of course.
That's 1,000 naira each month.
Exactly. And His Excellency at that launching gave a matching order that allowed people to pay 1,000 every month. And that has helped even some people to come on board. Because if we had insisted that people should bring that 12,000 before they get enrolled, a lot of people that are now coming to the office or enrolling wouldn't have been able to do. So how affordable it is, 1,000 naira every month. I have a boss who also says that equates to just 7 bottles of Pep Coke per month. So what you just need to do, a lot of us take one of these things every day, almost every day. Just for 6 or 7 days, don't take this Coke, Coca-Cola or these other soda drinks, and you get your 1,000 and you can pay for that month. And that benefit package, you need to see it. Over 200 diseases, including surgeries, on our benefit package. And once you pay, you'll be taken care of.
So the idea of health insurance is that once you pay this minimal amount each month, when you actually do have like a medical, maybe emergency or a medical ailment, you will then get treated for free because you've been paying this amount.
You'll get treated for free if what is troubling that person, it's on the benefit package.
And you said there are over 200.
Of course, not everything. Brain surgery is not there. Renal transplant is not there for now.
But you list maybe some of the common ones that are there.
We have a flyer where we list, and
is there a website that people can
our ogushia.org, OGSHIA.org. The benefit package is there.
So how does one identify sort of where they fall in? I mean, you've listed 3 tiers: the civil servants, public servants, and organized private sector, informal sector, vulnerable. Let's say there's someone listening now who is not currently on a health insurance plan, and they're trying to determine, okay, so which one do I fall under? How do they?
It's very straightforward. If you have a job that you get paid at the end of the month, you're in the formal sector. Because the formal sector covers both civil servants and the organized private sector.
Okay.
Right. You are in the formal sector. Gboyega is also in the formal sector. If you're an artisan, if organizers, the traders, the bricklayers, and so on and so forth that gets paid every day or every time they get a job or a customer, they are in the informal sector. The market woman, the Okada riders.
This 12,000. Is it a family package or just for a single person?
Very good. It's just that we have 2 plans. We have the individual plan and the family plan. The 12,000 is individual plan. The family plan is 48,000 per annum, and that also gets to 4,000 naira per month.
So how many members of the family?
6 members. You'll notice that has also been discounted because 6 members should give you 72 instead of 48. I should give you 6,000 instead of 4,000. So this is all to encourage people to come on board and at least experience the benefits of health insurance.
So for anyone in the informal sector now, all they have to do to get on this health insurance scheme is to...
Number 1, go online. If they are internet savvy, go online, go to our websites and register there, and someone will give you a call and get you enrolled. Register is you've expressed interest. After payment has been made, you become enrolled. Or go to some of our secondary facilities where we currently have a corner. If you go to Jaye now or State Hospital or Taojebode, to mention a few, there are corners where the health insurance team is there to register people. The other way is that we have people we refer to as third-party administrators in all the 20 local governments. And these are people that we can also direct you to, but they can even come to you if the number is sizable enough. You want to register 5-10 people, they will give them an appointment, they will be there to register you. The registration app, it's on the phone, and so it's easy. It's all internet, and once you are registered in any part of Ogun State, we sit in the office, and once we confirm payment, we print your card and get it back to the person.
So let's talk about the level of penetration. I know it's still the early days,
that is a question I usually don't like.
The governor just, officially and ceremoniously launched in February. He said some underground works has been ongoing since last year. So what has the level of penetration?
I will give you for the formal sector. Nobody has been registered because there are some issues that we are working behind the scenes to clear. And of course, once we can clear that, it's going to be a very big success and a big leap for us. because a situation where all civil servants with their dependents come on the health insurance scheme will give us a sizable chunk and create a very good pool for us. For the informal sector, we've registered, as of today, 1,743 people. For the vulnerable group, that's why we're doing very well. We've registered, I'm sure 50,000 less, maybe 20, 23 people. So if I can, we've registered about 49,970 something people in the vulnerable group. And these are people that we're taking care of so well so that they can be our champions and ambassadors in those communities in the states.
All right. Well, the vulnerable and the informal sector sound pretty straightforward to me. You know, for the vulnerable, it's free. For the informal sector,
1,000 per month.
Yes, contact. But for the private OPS and the civil service, you said they deduct salaries. Do you mandate the percentage deducted from their salaries? Do you also mandate how much the company as well also adds to it? And then if there's a company that perhaps is flouting this, there's a company where the workers are not entitled to health insurance, is there something they can do to alert Ojshare?
They can call us that the workers have interest and the management do not, and we'll come in and we'll talk and resolve this. The basic principle is that in the formal sector is also still 1,000 naira per month. But there's also this issue of equity that normally applies to the formal sector. That the more you earn, the more you should contribute to that. Let me just give you a very straight arithmetic. Assuming there's an organization that has 10 people. And so our calculation goes thus. 10 people should contribute 220,000 to us. Abi?
Yeah.
But these 10 people are not all earning the same thing. You have someone maybe on level 1 who's earning 10,000 and somebody on level whatever who is earning 100,000. It is not really good in that spirit of fairness and equity for that person earning 10,000 to pay 1,000 naira and that person earning 100,000 to pay or to pay 4,000 for their family. So what we normally do, as I mentioned earlier, is the fact that we'll now sit down and do a calculation based on the salary structure of that organization and the number of people in that organization to work towards that 120,000. So when we look at the basic salary, we'll now say, okay, if you take 1% of the basic salary and we calculate it for these 10 people, does it give us the 120? Very simple. So you understand, it depends on how well paid that organization is and how many they have. And usually at the end of the day, because what we want to do is that those on that lower rung who cannot really afford that more money can be taken from their salary will not pay much. So you have a situation where that person that is earning 10,000 may not contribute more than 300, 400 or 500 naira a month. Because the one collecting 100,000 will now pay about 1,500 instead of 1,000.
Another question I would like to ask is the effectiveness of this, because many people have complained about the state of government hospitals. And so beyond government facilities, PHCs, the secondary healthcare facilities, does this extend to, private hospitals? Because I was seeing a picture of FMC where some of the victims of the Owo attack, are being treated, and you could see them lying down without even as much as a bed, So it shows there is a decay in the health, in the health sector. So say I've paid for
everywhere, at every level, exactly. Both public and private.
But say I've paid for health insurance, and then I get to the hospital, I see the doctor, I get a prescription, and then I get to the drug store, and then they do not have maybe a particular drug. What happens then?
Well, let me quickly also just correct this. You should not, under insurance, expect a particular drug. But your doctor or the health worker prescribes what he or she thinks is going to work for you. Now, that does not take away the fact of there are a lot of things that are wrong with the health system. Agreed. Of course, there's no perfect system anyway. And it's possible for you to get to that place and then say that particular drug is not available. the owners lie on that facility to provide that drug for you. For those people that are on our basic healthcare provision fund, for example, the law states that if they go outside to buy the drugs that they should have been given in that facility, and they let us know, we will deduct their capitation and reimburse these people. These are part of the things that we are trying to do to make sure that we improve the system. Of course, you also mentioned one of the feedbacks you get is that people want some particular hospitals of their choice. Presently, we have 49 private facilities on board. And there are places in Ogun State where there are even no private hospitals. But when you want to come on board, we give you this list of hospitals that are on board. As I said, 160 PHCs, about 29, 30 general hospitals, and 49 private hospitals. We are doing pretty well. And every day we are empaneling new facilities. We have our accreditation process that also needs to meet the state's requirement and the national requirement. So it's not as if we're just going to bring in people. But as facilities express interest, we bring them on board.
But do they have the luxury of choice?
The
enrollee.
Definitely. Of course, the first principle is that please, as much as possible, pick a facility that is closest or nearest to your place of residence, not necessarily that one that you feel is the best. Because you have situations where someone in the living in the Mashai and picks State Hospital Jaye, and usually because of the cost of transport, it doesn't make use of the card. So it doesn't make sense. Pick a facility close to you. If that facility cannot treat you, or the case is more complicated than what they will refer you. So that means at every time you can still get your basic services. And when there's need to, they will refer you to even that Ijayi that everybody is picking as their first choice and they are not making use of.
All right. We'll be opening phone lines pretty shortly. I'm sure you have questions today. Our blanket topic is health insurance for Ogun State residents. And as a resident of Ogun State that presumably you are, this has to do with you. If you have any questions regarding health insurance, whether you are in the civil or public service, the organized private sector, the informal sector, or you consider yourself vulnerable and you have questions, we have the Executive Secretary of the Ogun State Health Insurance Agency, Dr. Folabi Dusumu, with us as our guest. And he's answered our questions and he's here to answer your questions as well. We also have social media, Facebook Splash FM 106.7, Twitter Splash FM 1067, and WhatsApp 081-7555-1067. Send in your questions there. They'll be read out and Dr. Dusumu will answer. Can we talk about health insurance really without talking about revitalizing the primary health centers?
Nope. Because everybody expects the best in life and quality is always an issue. I can tell you since we started this health insurance, it's something that people don't know. But we've even started employing doctors and putting them in our PSCs. They may not know. We've started. I think the first round of employment were for 25 doctors. We call them roving doctors because every week they're expected to go to 4 PSCs. So there are PSCs in Ogun State presently that every Monday at least you will see the doctor in this particular PSC. Then every Tuesday you see a doctor in this particular PSCs and so on and so forth. And by so doing, we've covered about 80 to 100 PSCs. But the next tranche, the adverts are there. People out there will have seen the adverts placed by the Ogun State Primary Healthcare Development Board. The plan is to employ another 65 set of doctors who are now going to be stationary in particular places. And this has been made possible because the capitations we paid to those facilities, it's enough to pay for these doctors. And this is what our people want, that they want to get to that facility and meet a doctor there. And so by the ending of July maximum, we'll have about 65 plus 25, 90 doctors at the PHC level. So the Honorable Commissioner is doing a lot to revitalize. Drugs are now being provided, quality drugs, also through capitation centrally and given to these PHCs to give to the enrollees when they come. So this issue of we're out of stock, the drugs are not available, also it is a thing of that we are not really experiencing in Ogun State. And finally, we encourage our enrollees, those that are paying and those that are on basic healthcare provision fund, that when you're in this facility, and you are not attended to on time, please call us from that facility. Don't go home before you now call or complain to your TPA. Call from that facility and let us address that issue. Our card has our outlines at the back of those cards, so it's easy for them to at least call, and somebody picks your call and talk and address whatever challenge or issue that you are experiencing there.
All right, we're opening phone lines now to get in your questions, as many of them as possible. We'll ask that you keep your questions, your contributions to 1 minute, perhaps 1 minute, 20 seconds if you need to overextend. The numbers are 0704 400 1067, 0817 444 1067, 0817 555 1067, and 0705 050 1067. Hello, good morning.
Good morning.
What is your name? Where are you calling from?
Afolabi is my name. I'm calling from Abeokuta.
Afolabi, make it quick. Go ahead.
Yes. Good morning, doctor. Yes,
Morning, sir.
This scheme is laudable. It's quite very good for us. But my own fear is this. You know the kind of country we are. We don't continue any good project. So my fear is about this issue of continuity. What is the plan so that this kind of scheme can be sustained by successive administrations, and not that at the end of the day it will see the light of the day more than this regime?
All right, thank you, Afolabi. Your question has been noted. Dr. Dosumo, if you...
Thank you very much, my namesake. And in as much as structures are not means of looking at sustainability, if you know the immigration head office at the Atladieri entrance, our office is just by the side of that immigration office. And it's one of the things that I'm happy with this administration and they've done for us. They've given us a very beautiful edifice. You need to see it to know that this program has come to stay. Now, on a more serious note, there is a law now backing health insurance in Ogun State. So that legal framework is there. And it's going to predate any administration. And if you look at what is happening, even the National Health Act and health insurance has come to stay. It has come to stay.
I mean, one worry may be funding, that some point
As I said,
stopped.
every law, both at the national level and even the state level, has prescribed sources of funding. Even the state health insurance law has prescribed some sources of funding.
So after this 100 million grant is finished,
even before
more
it's finished, definitely. And of course, we're working. Well, don't let me reveal everything.
All right. Let's talk about information too. Information, they say, is power, of course. How well would you say the people of Ogun State have heard about this? Because beyond putting up a laudable project or trying to help the people, as it were, it's also important that the people are aware. So, what is your agency and the Ministry of Health, doing to ensure that people at the very grassroots and even in the city centers, also get to hear about...
Thank you very much. The awareness is still very low. I will admit that. In fact, we carried out a very small research or survey, if I may call it that, and we discovered that less than 20% of residents of the state knows about health insurance or even what we are doing. Of course, there are plans in the pipeline. My coming here today is one of the boosts to getting information out there. We are, in the next 2 weeks, we'll be running some series of radio programs. And it's fun, but we will get there. Because the plan is, after the radio programs, we're also going to now look for sponsorship to run some TV programs. As part of our efforts in getting this information out there, we are signing a brand ambassador. Someone where we all know, I don't know if I'm allowed to let the cat out of the bag, that next week, it's because our political heads are in Abuja, we will have signed that contract. But next week, a very popular actor, resident in the States, is going to become our brand ambassador, and we'll start all these road shows, rallies, and so on and so forth, flyers, billboards, and these are part of these plans to get people to be aware. It's someone someone that recently won an award at the blah, blah, blah last month.
So he's going to give visibility to the
Exactly.
to the scheme. All right, 0704 400 1067, 0705 050 1067, 0817 444 1067, 0817 555 1067. That is also the WhatsApp number, the last number.
If there's any thing you feel we've not covered, because we know we've covered a lot, but on WhatsApp, Olajide Olawale Okwemi from Olorunshogo Bodi Abelta says, "Good morning, Splash. I am concerned about making the health insurance compulsory and not optional. An average civil servant in Ogun State, for example, is owed months of deduction from his or her account already. So deducting this every month would be a serious issue. Their take-home is already in jeopardy. What do you think is the way out to this?"
It's a valid question.
Okay, when you ask me about the formal sector, I say we've not registered anyone. Even though it's mandatory, we are not going to force it down anyone's throat. So it's all about sitting down at that negotiation table and reaching an agreement. And what he has mentioned are some of the issues that we are currently trying to resolve, because the benefits in it, we don't want a situation where we are throwing the bathwater away with the baby, or the baby away with the bathwater. The benefits are so enormous that some of these fears, we should sit down moving forward. What are we going to do for people out there to start enjoying this health insurance?
All right. We also have a question on Facebook, but before we, the question on Facebook is from Akoni Semiu Kolawole, and he says, all right, before I take his question, let me take this call. Hello, good morning.
Hello, good morning.
What is your name? Where are you calling from?
Yeah, my name is Ademola Oladosho. I'm calling from Abeokuta.
All right, Ademola, go ahead with your question or contribution.
Let me comment. This project is very laudable and highly commendable. And I want to also comment the implementation so far. But it's a great task for the agency. And I just hope they will have the will, the courage, and the support in all respects to ensure successful implementation. But sir, let me ask you, there's so much has been talked about, but what are the areas that this insurance policy will not cover in terms of healthcare treatment, particularly with regards to the elderly people, when we talk about geriatric medicine and other specialized problems like eye care, like kidney and whatever, all these highly demanding healthcare. What are the challenges and how are we going to resolve these challenges? Thanks so much.
Thank you, Demola, for your question. Dr. Dosumo will answer it.
Mr. Demola, thank you. Thank you for your encouragement. We need your prayers because, of course, nobody can do it all. But to answer your question, it's easier for me to answer what is on the program than what is not on the program. But you've mentioned some examples, geriatrics medicine, and I can tell you that most of the major conditions that are wrong with aged people, musculoskeletal systems,